Your child is choking. This is the moment everything changes. They can't make a sound. No crying, no coughing, no breathing, nothing. Their face starts turning red. And suddenly, everything slows down. You look at them, they look at you, and your mind goes completely blank. Because emergencies don't happen slowly. 1 second, everything feels normal. The next, panic takes over. Your heart races. You try to think clearly, but fear moves faster than logic, and in those moments, seconds feel enormous. What do you do now? If you hesitated even for a second, this video is for you. When something goes wrong with a child, people assume help arrives immediately. But real life doesn't work that way. Emergency response can take 8, sometimes 12 minutes or more. And when it's your child, those minutes feel endless. Because what happens before emergency crews arrive often determines everything. I've worked as a firefighter for over 20 years, and I've seen this truth again and again. The outcome is usually decided before we ever get there. Not because parents don't care, but because panic takes control when people feel unprepared. The first responder is almost never the firefighter. It's the parent already standing in the room. One of the biggest misunderstandings about children's first aid is thinking every child should be treated the same way. But a choking infant, a toddler, and a 10-year-old all require completely different actions. Even CPR changes depending on age and body size. For infants, you use 2 fingers, gentle pressure, precise positioning, controlled movement, because children's bodies are delicate. And if panic takes over, you can accidentally make the situation worse. Older children require different techniques, different force, different hand placement, different responses. That's why preparation matters. Not because parents are incapable, but because emergencies happen too fast to learn during the moment itself. But here's the part most people don't expect. This isn't complicated. It's not about strength. It's not about fearlessness. It's about knowledge, preparation, and calm action. A few hours of learning, a little reading, a bit of practice, and something changes. You stop freezing during emergencies. You stop depending entirely on panic and instinct. And instead, you begin responding calmly. You become the person who acts when everyone else freezes, and calm action saves lives. Emergencies don't come with warning, choking, burns, cuts, allergic reactions. They happen suddenly, usually when nobody expects them. And in those moments, preparation creates something powerful. Calm. And calm changes everything. First Aid for Kids is a simple, practical guide for parents, written by a firefighter with over 20 years of real experience. It's organized by age and emergency type, so you can find answers fast when you need them most. Link in the description. Read it before you need it. Stay safe.